Hey future nurses! Are you ready to face the single most important part of the NCLEX exam that could determine whether you pass or fail? Did you know that in the new Next Generation NCLEX, each exam includes at least 18 questions based on case studies, and your performance on these questions could make or break your chances of success? That's why today, we're not just talking about case studies, we're diving deep into the strategies, question types, and secrets you need to master them. Stick around until the end because I'll share the one strategy that could boost your confidence and skyrocket your chances of passing. Are you ready to level up and tackle the toughest part of the NCLEX like a pro? Let's get started. The NGN introduces case studies to better assess a candidate's ability to make clinical judgments and think critically. Unlike traditional exams that focus on recalling information, these case studies simulate real-world situations that nurses face in their practice. For example, you may be given a scenario involving a postoperative patient with abnormal vital signs, requiring you to analyze the situation, make decisions, and prioritize actions. 2. 3 case studies. Each NGN exam includes 3 scored case studies, each containing 6 related questions, making up a total of 18 questions. These case studies cover different clinical scenarios, ensuring a comprehensive evaluation of a nurse's ability to manage a variety of patient conditions. For instance, one case may involve a pediatric patient with respiratory distress, while another focuses on an elderly patient with heart failure. 3. Unfolding scenarios. Case studies use an unfolding format, where patient information is gradually revealed in stages. This mirrors how information is often received in clinical practice and requires candidates to adapt as new data becomes available. For example, you might initially receive basic patient details, but as the case progresses, you may learn about unexpected lab results or worsening symptoms that change the clinical picture. On the reference book NCLEX RN Case Study Practice Bootcamp, you are provided with many case study questions with unfolding scenario. These are not meant to confuse you but mimic the real practice environment. If you're watching this video and feeling the pressure of tackling those challenging NCLEX RN case studies, you're not alone. But what if I told you that the strategies and tips we're discussing here are all pulled straight from a game-changing resource designed to take your exam prep to the next level? Actually, the strategies for the case studies in this video is taken from NCLEX RN Case Studies Exam Practice Bootcamp. This book is packed with over 100 in-depth case study questions, each carefully crafted to bridge the gap between theory and real-world clinical practice. Whether you're dealing with anxiety or feeling unsure about the complexities of case studies, this book is the perfect way to transform fear into confidence. With a focus on first attempt success, this bootcamp will not only teach you the right answers, but also guide you through why other options don't make the cut, so you can learn from each mistake and grow stronger with every case. The author has helped countless students just like you conquer their NCLEX on the first try, and now you can benefit from their expertise too. So, if you're ready to boost your confidence, master those case studies, and head into your NCLEX exam prepared like never before, the NCLEX RN Case Studies Exam Practice Bootcamp is your trusted companion. You can find it right now. The link of the book is given in the description below. 4. Clinical Judgment Measurement Model. Questions of the case studies are based on the NCSBN Clinical Judgment Measurement Model, CJMM. This framework assesses how nurses collect and analyze data, make decisions, and implement interventions. For instance, a question might ask you to prioritize interventions for a patient with sepsis, following the CJMM steps of recognizing and analyzing clinical cues. 5. Multiple question types. NGN case studies incorporate various question types, such as multiple response, drag and drop down, highlight, and matrix grid questions. These formats test different aspects of clinical reasoning and decision-making. For example, you might be asked to drag and drop the correct sequence of interventions for a patient experiencing a stroke. 6. Realistic scenarios. The scenarios presented in case studies are designed to mimic real-life nursing situations, ensuring that the exam evaluates practical skills. For instance, a scenario about a patient with congestive heart failure might involve managing fluid balance, adjusting medications, and interpreting lab results over several days. 7. Layered information. Case studies provide information in layers, including nurses' notes, medical history, and vital signs, requiring candidates to synthesize data from multiple sources. For example, a patient's increased blood pressure may first be noted in progress notes, followed by lab data showing decreased kidney function, all of which must be considered together to determine the next steps. 8. Critical thinking. The NGN case studies demand higher-level critical thinking skills compared to traditional multiple-choice questions. Candidates must analyze complex situations, interpret data, and make well-reasoned decisions. For example, managing a postoperative patient with unexpected bleeding requires more than recalling textbook knowledge. It demands real-time assessment and action. 9. Partial credit scoring. Unlike traditional exams, NGN case studies use partial credit scoring, allowing candidates to earn points for partially correct answers. This system recognizes nuanced understanding. For example, if you correctly identify 2 out of 3 necessary interventions for a patient in shock, you may still earn partial credit. 10. Pathophysiology focus. A deeper understanding of pathophysiology is essential for analyzing case studies effectively. This knowledge helps candidates link clinical signs to underlying disease processes. For instance, understanding how diabetic ketoacidosis affects electrolytes and blood pH can guide decisions about treatment priorities.